It's been a while since I've reviewed the neuroscience literature pertaining to both anxiety and exploration. And so maybe we could start by you laying out what you've discovered and how you're thinking about what you think anxiety signifies, how it's related to exploratory behavior, which I think you described as something approximating courageous approach, although you were talking about mice in that particular paper, and what you're thinking about with regards to the neural basis of these different behavioral and emotional responses.
Sure, I'd be happy to. And I should mention that these days my laboratory mainly focuses on humans. We still do some mouse work, but we, in partnership with people in psychiatry, we're doing essentially equivalent experiments in humans. So I'd be happy to elaborate there. Many people perhaps, but not everyone, have heard of the autonomic nervous system, which simply means automatic. It's a bit of a misnomer because without going too much into the history of that, if you look back to the origins of medicine in the time of Galen and so forth, when they were first, dissecting cadavers and whatnot, there was this idea of a nervous system, or a portion of the nervous system eventually came to be, that could control so-called vegetative functions, meaning that rate of digestion and the really what neuroscientists typically think of as boring stuff, but it's anything but boring. It's the stuff that keeps you from urinating while you're asleep, unless you're a very young child, right? And it's the stuff that keeps your digestion going as you command your attention to other things. The autonomic nervous...
Right. It's all the things that are too complex for us to think through.
That's right. And they are, as you point out, immensely complex. And, nowadays with all this interest in the gut microbiome and things of that sort, I mean, these are tremendously complicated operations that are happening generally below our conscious awareness, and that are indeed vegetative. They can be controlled by emotion. We were all familiar with the idea that when we are emotionally distraught, that our digestion can be different, or et cetera. But typically, we can't control, for instance, in a conscious way, the rate of our digestion or the speed of our heartbeat in any kind of direct way. We can have a particular pattern of thought to control those. But in general, those functions were thought to be vegetative and outside of our conscious control. And the name autonomic nervous system sort of swallowed and overtook the vegetative part. So it includes that, but also three main aspects of body to brain signaling. And those three aspects are heart rate, could be quickening or slowing of heart rate. We are and we can be very aware of that, some of us more than others. Gut, and especially the chemical composition and the extent to which our gut is empty or full. So heart, stomach, and then rate of breathing and sort of depth of breathing, meaning how much air we have available to us. And I think the three main ways to think about the way that the brain and body communicate is that it's either going to be mechanical or chemical. Let's use the gut as an example. Your stomach can feel acidic, or it can feel nice and warm and fuzzy, whatever that is in a chemical sense. Your heart rate can feel like it's going at a rate that's appropriate for your circumstances. If you're running, it could be quick. And if you're sitting in a chair quietly at the doctor's office waiting to be called back there, and all of a sudden your heart starts racing, then you would think, well, that's appropriate for that situation, but it's not uncomfortable, right? It's out of sync with what you are doing, which is sitting. So there's mechanical information, and then there's chemical information. And with respect to your lungs, you can feel like you're out of air or you have plenty of air. You can feel like your breathing is labored or it's easy, or in the chemical sense that the air that you're breathing, your lungs are burning, or it feels easy to breathe. So basically there's chemical and mechanical signaling from the body to the brain, and the brain interprets all of that. And we put all of that under the umbrella of the so-called autonomic nervous system. And the autonomic nervous system can really be best thought of along a continuum. And here I'll avoid complicated nomenclature, but I'll throw it out there for the aficionados. Some people have probably heard of the parasympathetic and the sympathetic. That naming is a little bit misleading. Again, what we can really think about the autonomic nervous system as is a continuum, or more like a seesaw, of at one end is alertness, and at the other end is calmness. Right? That is translated to the so-called sympathetic and parasympathetic nervous system, but I'll call it the alertness and calmness system just for sake of simplicity. So it's sort of like a seesaw, and it has different neural circuits, and basically whether or not you feel very alert or panicked, or alert but calm, or a little bit of anxiety, that's going to depend on the balance between this alertness system and the calmness system. If you're having a full-blown panic attack, then the alertness system is, it's as if the seesaw is tilted all that way. If you're deeply asleep, well, then the calmness system is really tilted down. You could say that's a portion of the seesaw. This is all kind of obvious and dates back, 100 years or so, which isn't that long in the history of science, but we've known this sort of thing for a while. Okay, what's interesting and I think more relevant nowadays is to think about one's own interpretation of those signals and how that relates to anxiety and, as you pointed out, exploration, and then to think about where the nodes of control are. In this seesaw model that I'm putting forward, the seesaw has to include what I would call a hinge, a location in the middle in which you can voluntarily adjust the seesaw to either be more tilted toward alert or more tilted toward asleep. And for many people, they find that their overall level of autonomic arousal is either inappropriate or inadequate for the demands of their life. Inappropriate meaning their heart is racing, they feel more jittery, more as if movement would be the default and worry would be the default and anticipation is the default than is appropriate for their circumstances. Waking up in the morning and feeling stressed, for instance, immediately without any immediate cause or maybe stress about real life events. For other people, they feel more exhausted than they would like. They're having a hard time leaning into the pressures of daily life. Both of those, even though they have sort of polarized phenotypes, they look very different. In one case, over energized, and in one case, under energized. Both originate within the autonomic nervous system. And we can reliably say from work done in animals and humans that that is not the consequence of the alertness system or the calmness system being disrupted, but rather that hinge in the middle is dysregulated. And we now know what that hinge is. And this is based on work done by colleagues of mine at Stanford, in particular a guy named David Spiegel, who's our associate chair of psychiatry. He's done a lot of work, and his father did a lot of work in the application of clinical hypnosis, not stage hypnosis, but clinical hypnosis for the treatment of various things. But his work and some work in our laboratory now has shown that there's an area of the brain that you are familiar with, Dr. Peterson, which is the prefrontal cortex, and in particular, the left dorsolateral prefrontal cortex, if you really want to get down in the weeds about it, that has direct communication with two brain areas that are absolutely critical for this issue of whether or not you feel right for your circumstances, whether or not you translate that into a curiosity and exploration, or whether or not you translate it into this thing that we call anxiety. And those two areas are called the anterior cingulate cortex. Again, I apologize for all the names, but the anterior cingulate cortex and the insula. And I think if I were to make a prediction about what the buzzword is going to be in popular neuroscience in the next 5 years, it's not the amygdala, it's not the prefrontal cortex, it's the insula. The insula has a couple of different regions, but one of its primary regions, the front end, the anterior insula, is responsible for interpreting all those bodily signals. It essentially is a funnel for all those signals about breath rate, heart rate, conditions of the gut, whether or not your body feels ready to move or exhausted, et cetera. And that all funnels into the insula. And then also coming into the insula is information from classical areas like the amygdala, which are involved in threat detection and fear, and also emotion and memory. So the insula is really this incredible hub of information about somatic signals, about bodily signals. And then the prefrontal cortex, the dorsolateral prefrontal cortex in particular, is in communication with the insula and literally makes a...
So let me ask you about that. So does that mean that, the body in some sense is reporting to conscious awareness? Now it reports unconsciously in all sorts of ways too. So it might report to the hypothalamus, which is a very low level brain control area, by the way, for those of you who are listening. It might report to the hypothalamus primarily unconsciously. But do you think it's the insula that's reporting on the nature of bodily states to the prefrontal cortex in a manner that allows us to be consciously aware of our body states?
That's exactly.
Is that part of that integration system?
That's exactly right. You're exactly right. The insula sits as a different sort of station in that it's reporting to the conscious areas of the brain, to the prefrontal cortex.
Right. So we can take our own physiological state into account then when we're envisioning plans, because part of what the dorsolateral prefrontal cortex does is allow us to envision different possible futures. And those are plans. And you're not going to make a plan to run 2 or 3 blocks to get to the corner store if you're so exhausted you can't get out of bed. And you need a reporting mechanism that tells you what physical state you're in so that you can predicate your plans on that. You think the insula, at least in part, is responsible for formulating those those representations or for reporting those representations.
That is exactly right. In fact, the animal data and the human data, both lesion data and reversible inactivation data, support that in humans. So you have that exactly right. And as you mentioned, the prefrontal cortex, it gets sort of thrown out there for everything. I think, nowadays people have probably heard of the prefrontal cortex, and people hear about executive function, which of course is true. But if we were to really dial back and say, what is the prefrontal cortex in the position to do? It's a flexible rule-setting structure. How do we know that? I'm sure you are probably more familiar than I am with the classic Stroop task. You give somebody a bunch of cards with different words on them, and those words are written in different colors, and you tell the person, okay, just read the words to me. Ignore the color that they're written in, just read them. And so they're saying they're cat, dog, shelf, book, professor, student, etc. Then you quickly change the rules and you say, you know what, just tell me the color that the words are written in, but ignore what the words say. And people will do that, but there's a portion of time in which they slow down a bit. It's actually hard because you've done a rule switch. Much of life, as you know, and again, this is more your domain than mine, is about applying different rules in different contexts. Now, what we know is that the insula and the prefrontal cortex are both intimately involved in this conversation that establishes which rules are appropriate for a given situation. So for instance, if somebody were to say something that quote unquote triggers me, okay, I'll use myself as the example, right? Maybe someone will tweet something and I'll think, and I immediately want to respond in a way that I know I can kind of flip them on their back immediately. But then I think, maybe I want to refrain from that for any number of different rules or reasons, right? Well, then I'm starting to apply different rules. I'm starting to think about the context that's outside of the autonomic response. Because in a strict, very animalistic way, in other words, in the absence of an insula and a prefrontal cortex conversation, really the only thing an animal or human needs to do is just respond to their arousal in, it's either, you can either retreat, you can stay put, or you can fight, right? That's really the only three major.
And those are very fast responses generally. So let me ask you about the role of the prefrontal cortex in what you described as rule switching, because I would like to know what you think about whether or not the prefrontal cortex is actually, let's say, switching rules, or if what it's doing is switching context-sensitive behavioral patterns that when we talk about, we describe as rules.
It is the critical question that you're asking. The prefrontal cortex, in particular, the left dorsolateral prefrontal cortex, is in an incredibly unique position to not only establish different rules depending on context. And the way it does that is by accessing memory. So the hippocampus has access to prefrontal cortex and vice versa. It's almost always a reciprocal conversation. So it can pull memory thinking, the last time I responded like that didn't get me the result I wanted. Or the last time I responded in this other way, I got the result I wanted. Again, regardless of situation. The other thing that the left dorsolateral prefrontal cortex is exquisitely positioned to do, and this is beautiful work of a colleague of mine by the name of Nolan Williams, also in psychiatry, is because of its connections to some structures that then feed into the vagus nerve, it actually can slow the heart rate down. So in other words, let's say someone says something and your immediate impulse is to fight or to respond in a kind of knee-jerk way. If you halt, right, I guess what the meditators and the mindfulness folks was called the gap, or if you can access some memory and think, and you might be thinking, actually there's a much better way to place the dart if I just kind of lean back a little bit, or it could be, silence might be the best response, right? Or it could be that you're going to carefully access some data from your hippocampus to respond in a way that is most effective. For instance, here I'm talking about confrontation, but it could be any situation. The left dorsolateral prefrontal cortex does two things. As it acquires a new rule set or starts to access information about a new or possible rule set, it also sends a parallel signal to slow the heart down through the vagus nerve. And that is, I think, one of the more important and fascinating discoveries in the last 5 years. Those aren't data from my laboratory. I wish they were. But it's very clear that when we start accessing alternate rule sets, there's a signal that quiets the body in some ways and positioned.
Is that partly how you calm yourself down?
That's right. it is how you calm yourself down. And again, you have the clinical background, not I, but I'll confess I've been in therapy enough to know that occasionally, one feels as if you're accessing some piece of info as the patient side. I can only report from the patient side, accessing some, what feels like important piece of information. You're pulling on a thread of some sort, but then the therapist will say something and it literally gives you that alternate view. And this notion of looking at things through a different perspective, we often think about that as a switch in our cognitive frame, in our thinking, but also, we now know there's this parallel signal that's sent to the body in which, in order to access these alternate rule sets, new ways of looking at things, there's a calming signal literally sent to the body as well. And I find this conversation fascinating because normally we just think about anxiety and exploration and rule setting and rule responses or responses to rules, et cetera, as a kind of the body sends signals and the brain does all this, what neuroscientists have always talked about as top-down processing. Right, just sort of suppress the hypothalamus, control the limbic system.
Right.
And that's true to some extent, but there's also, it's clear there are signals being sent to the body in parallel. And rather than look at the signals...
It's more like conducting than suppressing.
Exactly.
Like conducting, like an orchestrator conducts.
Exactly. And there's a very interesting phenomenon that takes place in people that have chronic anxiety or for people who essentially stop accessing alternate rules and responses to these signals. And this is, I think, what is showing up in chronic anxiety, certainly in certain forms of depression, and when people enter states of rage and dysregulation, is that normally we know based on neuroimaging that the prefrontal cortex is essentially leading the response of this anterior cingulate cortex and the insula. So information is coming up from the body into the insula and then being fed to the prefrontal cortex. But then the prefrontal cortex is actually in a position to lead responses. And it essentially is acting like the coach of a team. And the team is all these structures like the ACC and the anterior cingulate cortex and the insula, the heart rate and so forth. What happens in individuals who have chronic anxiety or damage to the prefrontal cortex or dysregulation of these circuitries is that order actually reverses. The insula and ACC start leading and directing the response of the prefrontal cortex. And I think, we see this I'm sure you've seen this clinically in individuals. And while this isn't necessarily a discussion about society at large, I mean, we see this in dysregulated arguments and dysregulated combat where people is essentially losing themselves and they default to what appears to be very primitive rule set. And it may or may not be the appropriate one. Yep. But you and I, of course, have the good fortune of knowing a number of people who've worked in special operations and things like that. And you talk to any of those individuals, and they know from experience and from training that their ability to access multiple rule sets and options in the moments of extreme autonomic arousal is actually where their power lies, right? It's or a combat fighter, or let's just take, or in debate, right? Something that you're far more versed in than I am, right? Although I guess every academic has to deal with a bit of that coming up, thesis defense, et cetera. In a really good debate, you can't allow the autonomic response to overtake you, or you lose access to an enormous database that resides in one's hippocampus, and one then defaults to the bodily state, right? And this is what we see when we see people become dysregulated in rage, et cetera. So if we were to zoom out and then ask, where is the line between exploration and anxiety? I think that we can check off a few boxes for sure. First of all, that autonomic arousal, this tendency to be more alert or more in action than in non-action, is a very healthy response. I mean, the moment adrenaline is released from the adrenals, and as you know, there's a parallel signal in the brain. You get adrenaline released from the adrenals if you get in a cold shower or somebody says something triggering or you are afraid of heights or something. But the brain has its own kind of adrenaline system, which is this structure in the back of the brain called Locus Coeruleus. And it basically it essentially sprinklers the entire brain with noradrenaline and adrenaline. It's a very interesting system. It lacks specificity. It basically wakes up the whole brain. If I were to put a little, if I were to label the connections of the Locus Coeruleus, it's basically connected to everything. It just kind of sprinkles a caffeine-like substance on the entire brain, wakes you up. The adrenals in the body wake up the body. So two parallel systems wake us up.
Is that associated with the orienting reflex?
Yes.
If you orient, does the Locus Corrillius wake up the brain?
Absolutely. Yeah. So it's a key component of the so-called reticular activating system.
Reticular activating system.
Yeah. Yep. And incidentally, I should mention this because I was going to come to this later, but I think it's relevant now. If somebody has a lesion in their dorsolateral prefrontal cortex, or if you transiently inactivate it with a technology, a non-invasive technology like transcranial magnetic stimulation, they can now just put a magnet on outside the skull and quiet that area of the brain transiently. In animals or humans, what you find is that person or human becomes incredibly accurate at any motor task. So for instance, if I were to give you a shooter game where you're supposed to shoot targets and you're shooting targets, you'll have some hits and some misses, like anybody. If I inactivate your dorsolateral prefrontal cortex, your accuracy goes through the roof. It's near 100%. But the one thing you can't do is decide whether or not you're shooting an enemy or a friend. So you can no longer establish rules. You just become very good at execution of the motor behavior. Similarly, in an animal or person without a dorsolateral prefrontal cortex,
you see a trade-off there, right, between specificity and flexibility.
That's right. And so we see this theme over and over again, where as a purely, sensory motor response machine, the prefrontal cortex isn't even necessary. In fact, if you get rid of it entirely, people become like machines. If I click over here, somebody has no prefrontal cortex, basically everything becomes a stimulus. A puppy, everything's a stimulus. I used to have a bulldog. When he was a puppy, you had to worry about leaving cords out and everything went into his mouth. By the time he was, a year old, in part because he was a bulldog, he just kind of lay there. Like you could put a toy in front of him and he wasn't into playing and just leave it alone. A baby, everything's a stimulus. Many adults become infant-like in their responses, right? When anxiety is high. In fact, I have a friend who's a psychologist. Tell me if you agree with this statement or not, that anxiety makes children of us all. I don't know if that's true or not, but certainly has been my experience that when feeling anxious, I don't struggle with chronic anxiety, but I certainly have felt anxiety.
Well, it simplifies us. I mean, all these underlying emotions and motivational states, these primordial instincts, are simplification mechanisms. And so if we're unable to compute a complex and sophisticated pathway forward that takes multiple variables into account simultaneously, we can't just do nothing. We're going to default to a more primordial and direct state. And then you might say the whole panoply of emotions and motivations lies there at the weight for us to grip our behavior if we're paralyzed by inability to choose between multiple options. And so we do, to the degree that we're simplified by an emotion, then we're reduced to something more approximating an infantile state. If you watch 2-year-olds, and 2-year-olds are particularly interesting in this regard, they basically just cycle through innate motivational states. It makes them really interesting to be around because when they're interested in something, they're 100% interested in it. And then when they're angry, they're 100% angry. And if they're anxious, they're 100% anxious. And tired, they just instantly fall into a coma. And they just cycle through these with no overarching centralized integration. And it's partly because they likely don't really manifest any integrating prefrontal cortical capacity until they hit about 3, where they can start to engage in joint play states with other children, right? And then they can exercise, then they can modulate their underlying emotions in accordance with an abstract representation or goal, sometimes that's jointly shared. That's part of developing sophistication. It's also why the idea that identity is subjectively defined is absolutely preposterous. It's like, it's subjectively defined for 2-year-olds, but it's not subjectively defined for anyone who's sophisticated enough to negotiate with someone else.
There really aren't other motor responses for an animal, including humans, right? You can either stay put,
right,
back up, or go forward. And this is...
Yeah, well, it's useful for people to know that that's the basic platform upon which emotions are erected too, is that emotions are like signals of those action tendencies, and they are very simple. It's back up, get away, stop, or move forward. And so generally, we associate positive emotion with forward movement, and that would be positive emotion that's dopaminergically mediated fundamentally.
Right.
And then the halting would be, well, it can be calmness because there's nothing to do, but it can also be the paralysis that fear induces. And then panic and retreat are they're sort of on the border between anxiety and pain, I suppose. pain responses.
Yeah, exactly right.
Complicated in yeah.
Yeah,
Okay.
so these three major categories, I think, encompass most, if not all, of the possible responses, as you said, and probably form the base set for all emotions. I mean, my laboratory studied this mainly in the context of fear and confrontation. And one of the reasons we started to explore this was the following. You know, we've all heard of fight or flight, or rest and digest, right? Those correspond to the alertness system and the calmness system of the autonomic nervous system in their kind of extreme forms. But what we observed in animals, and then now in human studies, we published about a year ago, is that when people are confronted with an anxiety-provoking scenario, in our case, we do this with virtual reality because we need to do it in the laboratory, we find their pain point, essentially. And by pain point, I don't mean extreme fear. I mean the thing that can raise their autonomic arousal, that has them in a mode of considering different options and trying to figure out what is strategic and what they're capable of in that moment. Could be heights, could be confrontation with a predator, animal. It varies by person, people, but everyone has their pain point. Even Navy SEALs that we brought to the laboratory, or other people from the special operations community, each and everyone has their pain point. What they do in response to that pain point is really what's interesting. And what we found was that the pause or freeze response certainly was associated with autonomic arousal, with stress and anxiety. We measure this in the brain and body. But it was the lowest anxiety response. People always think of panic, just being paralyzed in panic. That's actually the lowest anxiety response. Retreat was the next level up in terms of levels of heart rate change and levels of change within the insula of all places. We actually recorded from human insula through a partnership with neurosurgeons. And then we found that there were a subset of individuals and animals in the parallel animal work that would confront a fear, not necessarily reflexively, but after some consideration, they would lean into the challenge, essentially confront the thing that was making them feel anxious. And it turned out that response, surprisingly, was associated with the highest levels of autonomic arousal. And this gave
right. So, but that would be heart rate activation, particularly
heart rate activation heart rate activation and a change in what it's called the so-called gamma wave activity in the insula. We had electrodes in the insula, and what we found was that people who were willing to lean into that challenge, the insula took on essentially a change in its activity patterns, this gamma pattern. The heart rate increased, breathing increased, sweating increased. So these are all the marks of an anxiety attack. But here, if you were to just look at the behavior of the person or the animal, what you'd find is that they were marching forward toward their fear. This is and so then...
That's voluntary exploration.
Right.